What's up, guys? Dr. Brooks, and this month we're talking headaches. So, specifically, we're going to talk four different types of headaches, what differentiates those types of headaches so you can identify what type of headache you're experiencing, and then what you should do for said headache. So, as you can see listed below, we've got four different types of headaches listed. The first being a tension type headache, the second being a migraine, third sinus, and then fourth cluster. So I'm going to talk about some basic differentiating factors between those, and we'll kind of go from there and then talk about treatment approaches. So number one, tension type headache. So classically, this is a headache that will manifest kind of through the forehead and behind the eyes, and will be hallmarked by a presentation later in the day. So basically, you won't wake up with this headache. You'll get this after a long day's work. So tension type headaches get their name because they're associated with tension through certain structures and or joints. Classically, we'll see that tension manifest in it's called the suboccipital group, which is a muscle group right at the base of the skull, the upper traps, and then even through some of the mid-scapular musculature and joints, so the joints in the cervical and thoracic spine. So again, later in the day, headache on both sides through the forehead and into the eyes. Second would be what we call a migraine headache. So classically, a migraine headache is associated with what we call an aura. An aura is otherwise known as a visual disturbance that precedes your migraine or precedes your headache. So if you notice any type of visual disturbances or visual changes, such as blurred vision, or some patients will describe almost like a blurry ghost-like image that goes across your eye, that's going to be indicative of a headache to come. That's classic of a migraine. Migraines also typically have sensitivity to light and sound, and then nausea associated with them. So I mentioned tension type headaches, both sides of the head. Migraines can be both sides of the head. More often than not, though, they'll typically manifest on one side of the head. So ipsilateral presentation, so one side of the head, visual disturbances, nausea, light and sound sensitivity for migraine. Sinus headaches are indicative, or excuse me, hallmark of nasal congestion and scratchy throat. So if you can hear it in my voice, I've actually got a little bit of a sinus infection here that I'm fighting off, or have been fighting off for the last few days, and that's going to be associated with some type of a viral or bacterial infection that's going to manifest in the sinal cavities. You have sinuses above the eyes, through the nose, and then through the cheeks. And that's typically where that headache will lend itself, or will kind of fester. So again, both right and left side, but it'll be associated with, like a cold, basically. Last type of headache is a cluster headache, and what differentiates these is it will be just one-sided, so just right versus left side of the head. And patients classically will talk about a dagger-like sensation to the eye. Okay, so in the grand scheme of things, cluster headaches are the least common type of headache. I think the etiology is somewhere around 3 to 6% of all headaches, so really, really uncommon when you compare it to the other types of headaches. So again, some really important differentiating factors there between the four types of headaches. So again, what side of the head are you experiencing your headaches on? Is it right-sided versus left, or both sides? Or excuse me, not right versus left. Is it one side versus the other, or both sides? What time of day? And then some of those precursors like visual disturbances, and then scratchy throat, cough, and runny nose are going to be some of those factors. So this is important because treatment looks different for each one of those types of headaches. So we're going to kind of work backwards here. So cluster type headache, if you're experiencing a cluster type headache, you probably don't want to reach out to your chiropractor or myself or Dr. John. You'd probably want to start with your PCP, your general practitioner, and kind of let them play lead. Typically, cluster headaches are going to be what would have what we call a multimodal treatment approach. So you're probably going to be co-managed between a couple of different professionals, but your chiropractor is not going to probably be on that team. A sinus headache, again, as I stated before, associated with a viral or bacterial infection. Again, you're probably not going to want to see your chiropractor for this type of headache. At the end of the day, you're going to want to give it a little bit of rest, some good fluids, probably do yourself a neti pot or two, and then maybe some essential oils to kind of help to mitigate some of those symptoms. If you're experiencing a migraine or a tension type headache, you absolutely should reach out to a chiropractor like myself or Dr. John, because we have really great luck with these types of headaches. If we had to compare tension type headaches and migraine headaches in terms of our effectiveness with relieving symptoms associated with those headaches, we do have better luck with tension type headaches and migraines, but we do have really great luck with the both of them at the end of the day. So again, look for some of those identifying factors that I mentioned before with regards to a tension headache and a migraine. So again, headache that manifests towards the end of the day, both right and left side of the head. Headaches that are associated with light and sound sensitivity, maybe some nausea or a visual disturbance. If you notice any of those things, don't hesitate to reach out to a chiropractor, reach out to someone within our office, someone on our team, and we'll be able to find you some relief and be of value to you. I strongly believe that. So that's basically what I've got for this month. One more thing before I let you go. By far and away, the most common thing that I hear from patients, or the assumption that patients make, is a really bad headache is always a migraine type headache. So there is no defining factor that certain headaches aren't hallmarked by their severity. So you could be having a really bad sinus headache, or excuse me, a really bad headache, and it could be of sinus variety. It does not necessarily mean you're having a migraine headache. So a migraine headache does not equate to a really bad headache. It could be any one of those four types. So kind of try to identify some of those factors that we mentioned before, and that'll help you lead yourself down the appropriate route or treatment route. So hope you found this valuable, hope you found this informative, and we'll catch you on next month's Movement Monday video. Thanks.